Dr. Edwards. My name is Tammy, and I'm going to be doing a central line dressing change today. So I've already gathered my supplies that I'm going to be needing. I am going to verify my order that you are due for a central line dressing change. At this time, I'm going to ask my patient about his allergies, and I'm also going to verify his name and date of birth. Those all look okay. I'm going to need to put my bed up to a good working height, probably about hip level, depending on the how tall you are. So get him up to about my hip, and I'm going to put my side rail down. And I'm going to expose my patient's central line. About there for you. I'm going to move my table in here a little closer for me and also get that to about my hip level. Need my pen. All right, so I'm going to ask my patient to move their arm up so it's kind of out of the way. At this time, I'm going to ask my patient to put on a mask and to turn their head away from their central line. So I'm going to have them move it this way since their central line is on the right side of their chest, and I am going to put on a mask. Now for this skill, you can use a mask that you've already obtained, or you can pull it from your central line dressing change kit. I am just going to use the one that I've already obtained. So I will put this on, and I'm ready. I'm going to take this down so you can still hear what I have to say. Oops. All right, I'm going to wash my hands, and I'm going to put on some clean gloves. And I'm going to remove the old dressing, leaving the center of the catheter to be removed last. And sometimes they're a little sticky. While I'm removing the dressing, I'm also assessing my site for redness, drainage, crepitus, which is air underneath the skin, and swelling. Mr. Edwards' site looks just fine. All right, so I had that exposed. I'm going to remove my clean gloves, and I'm going to rewash my hands. At this time, I'm going to use my central line dressing kit, and I'm going to open this away from me. Careful not to contaminate the contents within it. And not to let my lid come back on my contents. Like that. Since I've already used a mask that I've obtained, I'm just going to remove the mask from here, and I'm going to remove my sterile gloves. Once I do that, I'm going to move my kit up to the corner of my table so I don't have a chance of putting my hands over top of it. And I'm going to kind of crinkle up my gloves to make them a little easier to put on and get out of my package. Once I obtain my glove, I'm going to step back so I'm not over my sterile glove package. You may have some problems with your fingers, as you can see. Don't panic. We'll fix this in a second here. We're going to put the other one on. We got all sorts of problems here. All right, now we can fix our fingers. And please make sure for this skill that you are choosing size appropriate gloves for your hands. If you are an extra large, to grab extra large gloves. Don't try to put on smalls or mediums. They have a tendency to break and are difficult to get on. We are going to remove this package. Careful not to drop that below my hip level. So you can do this skill one of two ways. You can actually set up a sterile field, or you can use your package as your sterile field. So I'm going to use the package as a sterile field. I'm going to remove my sterile drape and just set it off to the side. I'm going to grab my tweezers, and I'm going to grab my ChloraPrep. I'm going to pick up my catheter, and because I'm using ChloraPrep, I'm going to I can go from side to side. If I was using an alcohol prep, I would need to clean from the very inner cannula, or inner part of the catheter to the outer part. And you will do this for 30 seconds to a minute. The very last part of this cleaning, you will clean up the catheter to all areas that are going to be underneath your tegaderm. Carefully to set this down. And then you will dispose of your tweezers and your ChloraPrep. And then we will obtain our tegaderm out of our package. And we will try to place the middle first, and then work our way out. And then we will remove the white part. Sometimes it comes off better. Once you have removed that, there will be a label with the date, time, and initials, so you will need to fill that out. And we will place this on the side of the dressing, not over the center of the dressing, just on the side. Once you have done that, you can clean up your supplies. You can remove your gloves. And we will throw that away. And we will wash our hands and then document in the appropriate place.